Hi, and welcome back to the Dr. Mia Paquin podcast. I am joined today by Dr. Collin Davidson. We are so excited to have you, Dr. Davidson. As we get started, I'd like to have you just introduce yourself a little bit to our guests and
Sure.
tell us about how you got started in psychology.
Yeah, thanks so much for having me on. So I'm Collin Davidson. I'm a licensed psychologist in Minnesota and Kentucky, and I'm based in Louisville, Kentucky. I've been a clinical psychologist focused on adults for most of my career in hospital settings. But I switched more to like a management and quality improvement role almost 3 years ago with a mental health tech startup called Lyra Health. And then I also have a private practice on the side that's focused on financial therapy. As far as psychology goes, I feel like I got lucky. I had no idea of what actually a psychologist did other than what I saw on TV. And when I started to study it in high school and college, the more I learned, I just really enjoyed it because I've always been curious and just understanding why people are the way they are and helping people. Um, Whereas I know a lot of people, they think they know what a career is and then they have to switch majors. So for some reason, I just got lucky on that and have enjoyed it ever since.
And you have been really successful in your work, and you have tried a lot of different things along the way in psychology. Tell me how you started doing kind of financial therapy and what
Sure.
that even means.
Yeah. I think a lot of it is like me search. Those people who are listening who do research know what that is, but you often like look into the things that interest you because you also may have issues with it. So I'd never heard of financial therapy, but I read about it in then a New York Times article maybe 2 years ago or so. And it interested me just because it's an area of great need. We don't have a lot of expertise within the realm of therapy for people with financial issues. And then, of course, myself, I was very financially avoidant for a good part of my life until I started to read more about just the basics of personal finance and realize, like, hey, I can actually figure out a lot of this on my own. Um, so because of that, like previous struggle and what I found beneficial, and then also blending it with psychotherapy, it felt like, hey, this is something I might want to try. And I read a couple books to make sure it was actually what I thought it might be. And I've really enjoyed it. So I've been practicing. I've been a certified financial therapist now for over a year, and my practice has been active for about that time as well. So I got additional training to do that.
Wow. Okay. So kind of an area of interest on your own, but then you've been helping people ever since. How does it look different than regular therapy?
Well, I mean, it's just really fascinating. There is a couple research studies that have looked into mental health providers, psychologists, and other mental health providers and their relationship to finances. And basically, what it found is we're not good at it in general, on average, of course, but that compared to other professionals, we have less helpful beliefs about money and less helpful habits related to money. So I think that's why it's such an area of great need where it's often
Yes.
avoided. And I felt that way when I was practicing a lot of my career too. Like clients bring it in a lot, such a key part of people's lives. And then we're just kind of like, what do we do about this?
I think that's a great point. I mean, I think even for a lot of clinicians, having a conversation about the finances just of their therapy session with
Yeah,
is really hard for them to do.
exactly.
Um, so, the fact that they're avoiding and then, their clients avoiding and then it never gets remedied. And yet finances is one of the biggest stressors that people face.
APA did I think it was called Stress in America survey in 2022. And I was just looking at this data recently. Actually, I think it was like 66% of people said money was a big stressor in their life. So recent data showing that. And then we also know like some really interesting studies showing that, like when COVID happened, there was a Dutch research group looking at stress and mental health, self reported like general mental well being and people who had higher levels of financial stress reported lower levels of general mental well-being. So that was kind of an interesting longitudinal study that, wasn't purely a causal study, but it does show pretty clearly that there's a relationship there.
Yeah. 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 So really, I mean, we ought to be paying more attention to this
Definitely.
if we're really concerned about people's mental health. And I suppose that, modeling comfort in discussing it too. Yeah.
Exactly. Yeah, I think there's like and this is emphasized in the field of financial therapy, is self reflection on it as well. So even
Yeah.
if you're not a financial therapist, you
Yeah.
know, money is a taboo topic.
Yeah.
And
Yeah.
usually therapists are pretty good at taboo topics, but money is the exception.
Yeah.
And so if you haven't examined what is my reaction to someone saying, "Hey, I have this issue with money," or "I'm hiding spending from my spouse," or, you know,
Yes.
"I want to
Yeah.
make more money in my career." Like a lot of people will judge someone for that and then not know how to help them. And if you
Right.
don't even know that's happening, that's a big problem.
I hadn't even thought of that, Colin. Like, we ask people about intimate topics, but we
Yeah,
don't ask them, like, how much debt do you have? Um,
exactly.
do you give financial advice too? Or are you different than like a financial advisor? Or how does
Yeah.
that work?
Great
Yeah.
question. That's an important piece. So I definitely am not a financial planner. There are some certified financial therapists who are financial planners because to get that designation, you can either be in the mental health field and then get further training on the financial side or the opposite, essentially. Um, Most mental health people who have gone in to be a CFT are not doing financial planning. That's much more detailed and more like long range planning. Um, so a financial therapist, if you've gotten that additional training, typically, what we would do is just fundamental, like broad consensus type advice. Like
Yeah.
budgeting is generally good for people, right? Like I'm not going to say buy this stock, but I will say like, do you know how much money you're making and how much you're spending? Could we
Right.
look at that? Could we understand, what's going on there? Can I help you to like not avoid doing that? Because, clearly it's not something that is rocket science. People have thought of that before, but it's
Yeah.
harder to do than one might expect. So in other words, it's just like general consensus. If someone needs more expertise, I would certainly refer, and I have, to planners and also actually to financial counselors. So
Ah,
financial counselors, it sounds extremely
yeah.
similar, but they're actually like purely financial professionals. And they really they specialize especially in like debt management. So if someone has a lot of debt, they are great at helping people to maybe they declare bankruptcy or they have other ways of getting out of debt.
So it's kind of like, you're working with them kind of on the motivation and helping them implement strategies and dealing with the avoidance
Yes.
and the emotional aspects of it, relational aspects of it. And then there's kind of these advisors or counselors on the side that are helping them kind of
Mhm.
manage the actual financial
Yes.
logistics.
Yeah. Yeah.
Okay.
Often people I'm seeing in practice also have like other financial professionals working with them, or some people feel they're like, reasonably skilled enough to do it on their own.
Yeah.
But it is kind of that very practical advice on the, financial side, plus like habitual change, behavior change
Yeah.
type stuff. How did those habits come to be? How can we help you change those habits? So that's really more the psychology side of things.
Yeah. How is it, that, what are the factors that you look at in terms of how people make decisions about their
Mhm.
money and, is there stuff that happens early in life that
Yeah.
influences that? Or, what are the theories behind that?
hmm Yeah. One thing, just as a side note, like financial therapy is a pretty new field.
Yeah.
Um, so there's a lot of room to develop more theories, but what's been posited and studied thus far is essentially like there's financial scripts that get created, or money scripts is what they're called, but you can think of them as like schemas, which is a common term from cognitive behavioral therapy, that often get created related to life experiences with money. So seeing parents argue about money, losing a house, while your parents losing the house when they're a kid, positive memories as well, but often those negative ones really have an impact. And just seeing how your parents relate to money. Are they okay spending money? Do they overspend? Do they never spend any money? Do they make you feel guilty about gifts that you receive? I worked so hard to buy you this gift, those
Right.
kind of things. Those are memories that drive people's behavior into their adulthood, even if they're not fully aware of it.
So those early experiences and in addition to the schemas, how about values? How does that play a role in your work?
Yeah, that's another huge area. So, people are more familiar with goals, but obviously values are related but slightly different, where something that can't be fully accomplished, like a life direction. And so, especially in couples work, people may have actually fairly similar values, but they're not aware of it and they still have these discrepant ideas about how to spend their money. So we do work a lot on like why is money important to you? What do you want your life to be about? How can you, in a way that's consistent with those values with like your savings and your spending, for instance. So if education of your kids is very important, well, like how much are you saving for your kids' education?
Yeah.
Have you thought about that? Or if you want to, not work your entire life and enjoy your retirement, have you started to save for your retirement? Those things I think can be really helpful to help people make the hard decisions if they have to cut expenses, for instance, or do more work or take a different job to make more money.
So really helping them kind of align their behaviors with what their values are and what they want.
Exactly. Yeah.
Yeah. Yeah. Are there certain psychological conditions or personalities that might make being financially responsible harder?
Yeah. I mean, there's probably a need for more research in this area. So there's things called money disorders, which most of them are not like DSM diagnosable conditions. Like financial avoidance is one example, financial dependence, but that are considered diagnosable. Like hoarding disorder is actually considered a money disorder, for instance, gambling disorder. Certainly, people who are more conscientious as a personality trait are
Mhm.
much more likely to be responsible with their money, less likely to be impulsive and engage in like damaging financial habits. Um, and, I think this is also another area that shows that financial therapy is relatively new. There's probably more out there that I'm not aware of, but certainly an area where we need to learn more.
Yeah, absolutely. Absolutely. Well, and I'm also imagining like, people when they're in the manic phase and they're more impulsive
Yes, great point.
or a lot, as we these baby boomers get older, there's more dementia. And so
Mhm.
like thinking of, how does the role of dementia
Yeah,
play into all of this, and is there a role for financial therapy with families as people go through, that change of life? So,
absolutely. And some financial therapists kind of specialize in those like end of life or later life type issues like you're bringing up, or also related to that, like trusts, passing money down, which seems simple maybe, but it's actually incredibly complex.
but
How are you
yeah.
fair? Like this son makes more than this person, and do you give them the same amount of money or do you weight it somehow? And there's just a lot of fascinating ways that it brings up conflict for people.
Yes. Yes, absolutely. Yeah, and, like, trying to sort through that, um and for people who are avoidant, right? Like, the idea of approaching that conflict as well is
Mhm.
probably really hard.
Definitely.
Yeah. Tell us about some success stories. I mean, obviously, without, reaching
Yeah.
confidentiality, but is there, like, some feel-good stories that you have about the work that you've been
Yes.
doing? And
Yeah, yeah, definitely. So I'd say about actually my practice is probably 50% couples work, 50% individual work. With couples cases, most often there's this the misalignment in
yeah.
like their habits around money or even goals around money. And so where I've seen success in those types of presenting problems is basically people are getting closer together and how they can approach money. They know what their goals are together. They're taking steps either with a professional or on their own to like make those investments in kids' education or save for the vacation, whatever their goals might be.
Mhm.
And
Mhm.
it's really nice to see also that I think in comparison to most couples work, it's much shorter term typically. People they're headed in the right direction. They know they can come back if they
Yeah.
need additional support. With individuals, it depends a little bit more on like why they're coming in. But what I've seen most commonly is overspending tends to be a really big one. Lack of financial knowledge or avoidance of putting it into play. So what comes along with that often is debts, not saving for retirement, not saving for education or other goals. And so I've seen people who come in with a lot, those kinds of problems, and then, paying down debt. Now my 401k is being funded by my paycheck, and those things, which it's nice because it's concrete, right? Like
Yes.
it's very clear that it's happening, as opposed to, I think I feel less anxious now, right? Feel a little less depressed.
Right, right. You don't have to give them some vague screener about how
Yeah,
they're doing for the day or 1 to 10, right?
exactly.
You have the bank account numbers in front of you. If somebody were to come to you and they were just saying, "Hey, I'm having financial stress or I'm feeling overwhelmed." Is there any, I mean, aside from therapy, but any kind of first steps that you would
Mm,
recommend for them to take?
yeah, yeah. I mean, I think the first step likely is just to try to look at what the situation is.
Mhm.
Often the problem with this stress is there's probably some vagueness, and then our minds fill in the blank and make it feel much worse than it actually is.
Mhm.
Um, so, someone who maybe feels they can't make maybe they're in debt, they can't make their debt payments. Like, first, just look at how much money do you owe? What is the interest rate? What are your options to pay that off? Are there professionals in the financial realm who can help you make that plan and support you along the way? Like a financial counselor, and often those are like low fee, or even some organizations offer it for free, right?
Yeah.
But even if it's not, like, a lot of people I work with actually, like, they're making really healthy incomes, not all of them, but then they still are spending all their money, right? So that's another financial stress. Like, I feel like I just can't control my spending. Like, I'm never going to meet my goals. And
Yeah.
again, can we get some clarity? What exactly does that mean? How much
Right.
money are you making? How much are you spending? Where would you like to be there? Can you monitor your budget on a monthly basis? Those
Yeah.
kinds of things. And that can feel daunting, but often actually the lack of knowing is harder often than actually seeing the facts. 'Cause then
Mhm.
you can at least start to plan and make steps.
I'm thinking, with Amazon and all this online buying, it's
Mhm.
probably a lot easier to spend
Yeah.
money than maybe it used to be. Um, and I wonder with that too, is there certain steps that you work with people who might be more impulsive to put
Mhm.
buy now,
Yeah,
rather
that's a
than
great point. Yep. I mean, we've probably all heard the idea of, like, making things frictionless, which is what a lot of the tech companies try to do so you can spend money. And
yeah,
we wanna do the opposite, basically, like, make it harder for yourself to spend money.
yeah,
Some people, it's like, don't use credit cards, use cash or
wow,
a debit card,
yeah,
things like that. Or, can you actually track, even if you're using a credit card, take a notebook and track all of your expenses every day. Write it out. Okay, I spent $150 on groceries. That just adds another layer and, like, another kind of pain point, really, or more
yes.
friction, if you will, to spending. So it slows it down. It helps you think through, do I actually need to buy this? Is that a smart thing to do? Some people, it's helpful to actually open up to loved ones too, to, like, some for accountability, but often, like, relationships facilitate spending too, right? Where it's like, I want to spend money on my kids or my niece or whatever. And I feel great when I buy this expensive toy or I take them on a trip. But if
Yeah,
you talk to, family members and say, I'd still want to do those things, but I can't do that much. Now you
yes.
become accountable to them. And if you start to say, I'm going to pay for this vacation, they'll say, thought you told me you can't afford that.
Right.
You know,
Right. Yeah, so they're kind of looking out for you too and
Mhm.
holding you accountable.
Exactly.
I'm thinking too, like how many grandparents buy stuff for their grandchildren that, the parents are just like, we don't
Yeah,
need any more toys or,
exactly.
put this in a college savings account and just having, those conversations
Mm,
could be really helpful to both.
exactly. I
Yeah.
think another thing too, this goes for, like, all financial habits, but I approach financial therapy from, like, a cognitive behavioral perspective, and certainly other financial therapists use other perspectives. But I have people track what's a triggering financial situation for you. What are your thoughts and emotions, and what did you do? And what was the result of that? And then we can also get into later, let's examine those thoughts that you have. Like my, my niece won't love me if I don't keep buying her gifts.
Yeah.
Okay, let's look at the evidence of that. Could we ask her, if she's older or
Right.
something? And so that helps both just to see the habit and why sometimes people don't know why they're doing what they're doing. I just keep spending and I don't know why, or I can't make that budget and I don't know why. And it becomes clear that it's like has a purpose and a function, and then
Yeah.
they can start to change it.
Yeah. So you're really good at kind of helping people gain insight into why they're doing what they're doing. And say there's a hypothetical couple
Mhm.
um, that comes from different walks of life where, um, somebody wants to spend all the time, right? Like they're very much live in the moment,
Yeah.
right? And you have another person who's very planning and thoughtful. Um, how do you help couples like that kind of come together and in
Mhm.
their financial goals?
It's tough. I actually had a case like this earlier today. It's very common. Um, and there's also a book. I'll just throw this out there because
Yeah.
there's a book called Tightwads and Spendthrifts that just came out, and it's on this exact topic. It's great. But in that book, he actually talks about how there is some research to suggest that we're kind of attracted to opposites when it comes to spending.
Oh, interesting.
So
Okay.
you may be more likely to end up in that kind of dilemma. Um, how to help them? I mean, I think first of all, what we want to do is have them reflect on what were your experiences growing up related to money? It's like, what did you
Mhm.
learn from your parents related to money? Um, what did you learn from people around you? Were there any really painful memories around money in your childhood? What are your life goals related to money? And then also, what do you like admire about the other person generally or related to their approach to money? So these are I didn't invent these
Yeah.
from like a lot of people in the financial therapy field have come up with these. And it just helps people to reflect and get some empathy for the other person as a starting point before we get into like the nitty gritty of what are your goals? How do we like, compromise and things like that?
Yeah. Yeah.
Because they are often tied to like very deep, sometimes trauma, right? Uh,
Right.
sometimes just very stressful life circumstances. Uh, and instead of just saying you're the irresponsible one or you're the uptight one, whatever it might be, there's
Right.
reasons people act this way. If we can have some empathy, then maybe we can start from a point of like mutual understanding to create goals that are agreeable to both of us.
Yes. Yes. And certainly there's strengths in both.
Hmm.
Being able to spend is sometimes a good thing and being able to
Yes.
save your money is sometimes a good thing and finding that balance in the couple.
Exactly. One
Really.
practical piece of advice from the book I mentioned was spendthrifts should be the ones who plan vacations because generally people are more satisfied by spending money on vacations. So that's maybe not the time to be
Oh,
cheap. Or
okay.
like maybe take that extra day on the vacation or something. Whereas tightwads should probably have more responsibility for like daily expenditures. And like we don't get the best, you know, groceries from the most expensive grocery store every time.
Yes. Yes. I may have a family member who, when they go to the store, they know that their spouse always wants the most expensive item, and they will be going back if they don't get the most expensive item. So he just looks for the most expensive item, and that makes their marriage very good. But I can imagine in some couples that may not work. So,
Yes,
um,
exactly.
mhm, mhm, yeah,
Well, and for most people generally, like, you can't accomplish all your financial goals unless you're very wealthy or your goals are very, reasonable. Um,
right,
so
yeah,
there has to be compromise even if you're just living by yourself, right? You
right.
can't always afford everything you want, and seeing that with the numbers is often helpful. Then you can start to make the harder decisions of what's our top priority.
Yes, yes. Well, and so, like, thinking about different cultures and different generations, do you
Mhm.
see that there's certain, you know, I mean, we're talking generalities, but do you see
Yeah.
certain strengths or weaknesses in terms of, how people are managing their money?
Yeah, I do think it varies. Again, of course, it's on average, but like if you think of, for instance, on average, like a person whose parents immigrated from China, you know,
Yeah.
they often feel more responsibility to take care of their parents into their old age. And so
Yes.
that's something that perhaps someone whose family has been in America for a long time wouldn't feel as much of an obligation there. And you don't hear about that much. You hear about saving for retirement, saving for college, you
Mhm.
know, maybe for a house, whatever it might be, but you don't often hear, I'm saving up to take care of my parents into their old age. It's like
Mhm.
that's another financial consideration, but there's probably also a lot of benefits to that where may have stronger relationships or more control over the care that person gets in their life.
Yeah.
Um, I think on the practical individual level, just like broaching that topic, whether
Mhm.
it's like their culture of origin or even just the culture of their family,
Yes.
is like there's certain rules that people have just internalized and not examined around money
Yes.
and other things too. But our
Yes.
purpose is like just making them verbalize those is really useful. And me as the therapist, not actually making assumptions of what it might be,
Mhm.
money, and also trying to check any judgments I might have too, because those are also values based.
And with the different generations, are you seeing different trends? Like, are young people better prepared, less
Mm,
prepared,
yeah.
to make good financial decisions?
I'd be very curious to see like some representative data on that. That's the researcher in me. Um, Anecdotally, and I have read stories on this that, like some expenses can just be much higher now. Like going to college is not as easy as it used to be, for instance. And
Right.
even it was around the 90s really when like I read an article saying that expectations and norms around saving for your kids' college really shifted. Like before that, it wasn't happening very much. And now it's
Yeah.
almost like if you can, you're almost like derelict in duty to not save for your kids' college.
Right.
So I think a lot of like the just systemic factors around affordability have changed. I guess like access to knowledge may be greater, but there's also the factor of like quality of what you see online. There are like financial professionals and influencers who are targeting certain audiences like millennials or whatever.
Mhm.
I guess that's good if it gets more people to pay attention.
Sure.
Pending is the advice good, you know?
Well, and you just think about, yeah, things have changed so much, for old people like me, I'm thinking about, having to plan for college or, even things like, can we afford to have a dog, right? Or a
Yeah,
cat. Pet
exactly.
care is exponentially expensive or,
Exactly.
just looking at all these different things, and, yeah, and I think house buying too now has become
Mhm.
more difficult for young people, so, yeah, so many different things for them to consider, um,
Exactly. Yeah.
yeah,
And I
yeah,
don't know that there's any, I mean, it would be very curious. I know there are researchers who look at like just different characteristics across generations, but I don't know if there's been quality studies on like just financial habits outside of like these external factors that force certain decisions.
we need the researchers to watch this, so we'll
Yeah,
give you, like there's guaranteed 20 dissertation topics right from this,
exactly. For sure.
well, I think we've got some great new DSM diagnoses, so the DSM people will be very happy to double the length of the next DSM
Yes.
as well.
Yes. It'll be
So,
like multiple separate volumes.
yeah, one more question for you. There's not enough Dr. Davidsons out there to help everybody
Mhm.
with mental health concerns around finances, or financial concerns that are impacting mental health or well-being. Um, if somebody is seeking a therapist, a psychologist out to help them with stress, and some of it at least is related to their finances, you know,
Mhm.
what should the clients be saying to their therapist?
Yeah.
What should a good therapist be asking about or doing to make the therapy worthwhile?
Yeah. Yeah, we definitely need to extend this into just every therapist should have some level of comfortability with this because I was surprised to learn there's only 100 certified financial therapists. This was as of maybe a month or two ago, but I thought it'd be a lot higher. There's others who practice. It's not a requirement technically, but still you just think there'd be a lot more out there.
Yeah.
I'd say for a client, you'd probably just want to first of all just bring it up, make sure you're letting your therapist know, and then also follow up with how comfortable are you helping me with this problem? I have
Yes.
I have severe debt, or I have this overspending problem, or I have a lot of conflict with my spouse over money. Do you think this is something you can help me with?
Yeah.
And
Yeah.
then if the answer is no, is there someone you could set me up with that does have that comfort?
Yeah.
Because you don't want to hide it or assume that your provider knows what they're doing with it, or is not avoidant themselves of those topics.
Right.
I think for a provider, doing what I mentioned earlier, some of that self reflection. What there's a inventory you could fill out, for instance, as a starting point. The Klon's, uh, look at it. I just keeps escaping me. The Klon's money script inventory. So that might be a starting point. It has like 4 different types of money scripts people have related to money, and it could just help you reflect, like, how do I generally approach money? Um, how do I feel when a client asks me to lower my rate? Like, you could just ask some questions like that, or like,
Yeah.
how do I feel when I have to tell my clients I'm raising my rate because of inflation or whatever.
Right.
There's a lot of things you could do there.
Yeah.
The other thing I'd say is you probably can help people with financial issues more than you think you can. We help a lot of people problem solve so many difficult areas of their lives. And I think, you could help people problem solve, I'm spending too much money.
Yes.
Even if you're not a financial expert, you could say, okay, well, what are the possible solutions there? And you can brainstorm with them. And then you can also refer to financial professionals if necessary.
Yeah, and I think a lot of therapists have in their back pocket physicians, maybe even lawyers, but
I mean,
financial planners haven't traditionally been one that they've been thinking about.
there's a lot of like, good, we in therapy we call it bibliotherapy. But just like made for the general market on both financial therapy and just personal finance. Like, I really like personal finance for dummies because it's like comprehensive and it's also very like user friendly. But there's
Yeah,
so many out there. And you could at least learn some of the basics from
yeah,
that,
yeah.
even if because financial planners aren't cheap.
Right, right. Yeah. So kind of get familiar yourself at least with some of these basic concepts so that
Yeah.
when you come in, you know what they're talking about.
And you could suggest if they're open to it, like maybe check out one of these books and see if
Yes.
that helps, you to understand. At least that way it's a little more vetted than do a Google search on, how do I get rid of my debt?
Dr. Davidson, it has been a pleasure to have you on our podcast today. I know you have your own website, um, collindavidson.com. We'll
Yep.
put a link in our comment section here as well.
Great.
Um, but we so appreciate this knowledge. We need to be talking more and more about financial health and how it relates to our mental health. So, such a great topic to have you here for. I want to thank you again, and our viewers out there. Please make sure to like, subscribe, and comment